My name is Daniel Hill, and this is Laura, my wife. She's going to be helping me out today with my physical examination. Laura's pregnant, and you're going to have to bear with me because some of the examination is going to be altered because of her pregnancy. So before we get started, I'm going to have her urinate, and also I'm going to have her lay on her back with her knees bent and her arms at her sides. So go ahead and do that for me, please. We're not going to be here long just because I don't want her. I'm going to have her position of comfort. So if you start to feel dizzy or lightheaded, let me know.
Okay.
All right. Thank you. Inspect her abdomen using tangenting light or casting light across, and just inspect her abdomen for contour, pulsating masses, peristalsis, any scars, umbilicus hernias or lipomas, bruising, deformities, and symmetry. Okay, so I'll be looking in this area right here. I may see an aortic pulsating. Her abdomen is symmetrical. She's obviously got a little, what we like to call a baby bump. So next I'm gonna auscultate all 4 quadrants. Okay, so if you look at her abdomen, you can divide it into 4 quadrants. All right, in each quadrant you can hear different abdominal sounds and inspect for different things. In this case, and listen for bowel sounds. Okay, so first I'm going to make sure I go in the same direction, and I'm going to listen to this. Listen for 2 minutes, and listen for hypoactive, hyperactive, or normal active bowel sounds. All right. Because she is pregnant, I may have to lift nostrils to the sides. Okay. And as I'm going through, I can already hear that she has rhythmic gurgling sounds. I'm going to turn my bell real quick so I can make sure that it is, and then I can hear on this side. So I'm going to listen to all 4 quadrants. All right. Okay, great. Now I'm gonna check her arterial flow and check for bruits. Okay, so I'm listening with the bell side, and I'm listening for the aortic, and I don't hear anything there. I'm gonna go over the kidneys, right where they're. Normally I would be doing this without skin to skin. In this case, not doing it that way because of the privacy nature. Okay, no brewing. Alright, now I'm gonna find her iliac crest. I've heard it's not where it normally is, and I'm gonna have to go in a little bit and listen for bruits there. And I'll check them on both sides. Right there. Because of her pregnancy, her hips have shifted a little. Mm-hmm. So I gotta keep that in mind when I'm landmarking. And then I would also listen for femoral bruits as well. Okay. And the bruits will be indicative of stenosis. Alright. My wife is starting to feel a little lightheaded from laying her back, so she's asked if she can lay on her side, or I positioned her on her side so that way she doesn't feel any worse. The pressure from the baby resting on her vena cava, which is normal, and something that pregnant women must be conscientious of. So now I'm going to palpate all 4 quadrants, okay, starting with light palpitation, and I'm going to be checking for tenderness, rigidity, guarding, and masses, pulsating masses. And one thing I didn't look for earlier, but I will be looking for to be noted, is bruising. But this right now going around is going to be a light palpitation. Now I'll be doing a deep palpitation. I didn't note anything there, and I'll be using 2 hands. And as I go through, I'll palpate there, what she can tolerate, obviously. All right. And then using 2 fingers, I'll go in there. No pulsing masses, no tenderness, no rigidity. So now I'm going to check for her liver, okay? And what I'll do is I'll find her rib cage, ask her to take a deep breath, and I'll find her rib cage, feel right under her rib cage, and ask her to take a deep breath. Breathe in, breathe out, and as that's going on, I'm feeling for her liver. It should feel like a friction. I do not feel it, so her liver is not enlarged. Now I'm going to try and feel for her spleen using the hooking method as well. So I find her rib cage, ask her to take a deep breath, and I do not feel it. So I'm going to put across all 4 quadrants. So using this, it should be, in someone who is not pregnant, it should be a tympanic sound. And this case, for her, it may be dull in all 4 quadrants because she is pregnant. So, dull. Oh, more tympanic there, but dull here. Oh, dull. And down there, dull. So this is the side that she should be laying on. It's her left lateral recumbent position. It allows for blood flow. Now I'm going to percuss for her liver. Alright, should be 6 to 12 centimeters. And so I'll look for the midclavicular line, which comes down to here, find along her ribs, and I'll percuss. Wait till I get that dullness right there. Okay, that's right on her liver. Alright, I'd mark it with tape or a pen. And then from her belly button, I would work my way up until I find there's the dullness. So coming across here to here, I would measure. So let's see here, and it is 6 centimeters. In her case, her liver might be pushed up a little bit due to the pregnancy. Alright, now I'm going to percuss for the spleen. It's between the 6th and 10th rib, mid-anterior line. So anterior, right there. Now I percuss. Right there. Alright, right there is where it is. And alright, good. It's about 6 centimeters. Now I'm going to percuss the kidneys. So costovertebral angle on the 12th rib, which is roughly right there. Okay, 1 solid hit, and she should not feel any pain. If she does feel any pain, we know that there is something going on with the kidneys, perhaps a kidney stone or some type of infection. Same thing on the side. Any pain? No pain noted. Thank you for watching our video, and I hope you enjoyed it, and thank you.